Welcome to Women's Health Minutes, a podcast series brought to you by the American College of Osteopathic Obstetricians and Gynecologists. The opinions expressed are those of our speakers and may not reflect those of our sponsors. This podcast is not intended to replace professional medical advice. We hope you enjoy our presentation today. Thanks for listening.
Hello, everyone. I'm very excited to have our new incoming president, Dr. Jennifer Papp, with me, and she's going to talk to us a little bit about her plans for her presidential year and a little bit about herself so that everyone can get to know her. Dr. Papp, thanks so much for joining me. Could you tell the audience a little bit about yourself?
Well, first off, Dr. Patel, I want to thank you so much for inviting me on the Women's Health Minutes. This has been a tremendous program for ACOOG exposure, as well as a platform for women's health issues. So it is an honor for me to be with you today. And please call me Jen. My name is Jennifer Papp, and I am the current president-elect of ACOOG for a couple more weeks when I will be stepping into the role of ACOOG president. I want to thank Dr. Ashley Hood for his leadership over this past year. He set a high standard, and I am grateful for all that he has done for this organization. I want to say this is an honor that I don't take lightly. ACOOG has a strong history of leadership, and this is not necessarily a path that I had envisioned for myself. So I'm very humbled and honored by this opportunity and really excited to serve ACOOG and its members over the next year. A little bit about myself. I have been in practice in Columbus, Ohio for 20 years. I graduated from Ohio University Heritage College of Osteopathic Medicine back when there was only one campus in Athens, Ohio. I completed a traditional rotating internship at Doctor's Hospital, and then I stayed on for my residency at Doctor's Hospital, where I was strongly influenced by my program director, Dr. James Perez. Many of you who are probably familiar with him because he is one of the past presidents for ACOOG. When I completed my residency, I was lucky enough to be able to join my mentors at a practice that was an employed practice at Ohio Health. It was actually the first employed OBGYN practice. And we started out as a group of three, which was interesting. Call with a group of three is always a bit challenging, especially when we had the bright idea of coming up with being on call for an entire week. So that was a bit challenging. And when two of our graduating residents decided to join us the following year, we welcomed their addition. So we were a group of five. Even though the partners have changed, I've always been in a group of 5 physicians and 1 APP, which has been great as far as work-life balance. Call every 1 in 5 weekends, and we have a lot of great collaboration with that number of partners within the group. The other thing that has been a huge part of my career has been medical education. And from day one, I have worked in medical education. I think it's always interesting to go from being their chief resident one day to their attending physician the next day. And I genuinely enjoy teaching. I enjoy watching them go from uncertain to confident. Those moments when it clicks are truly meaningful. The other night when I was on call working with a first-year resident, we had a patient that was exhausted after pushing for 3 hours. And we decided that we were going to perform an operative delivery. She was anxious because she had never performed an operative delivery. We went through the steps. And after walking out of the room, after she completed the operative delivery, the confidence and the empowerment that she felt was palpable, that she had gained a skill to help a patient avoid a cesarean delivery. I also enjoy being a part of residents' milestone moments, their first C-section, their first robotic hysterectomy. These are moments that truly define us as educators. I must say, at the end of the year, when they're graduating and getting ready to fly the nest, so to speak, I'm a bit melancholy for a couple of days. But then July 1st rolls around, and we have new residents with energy, curiosity, and a fresh perspective, which remind us that it's important to continue learning ourselves. As far as the second half of my career, I have become more involved in leadership. And I still play a role in medical education, although I don't cover the residency clinic during the day or labor and delivery. I still help out with night call and weekend call. But as my leadership roles expanded locally, I became the division chief of OBGYN at Doctors Hospital for a number of years. And then eventually the medical staff president. And then after that, the Ohio Health Board of Directors, where I served on the Finance and Audit Committee, as well as the Quality of Care Committee. And I think through these experiences, I really gained a perspective on leadership, the importance of collaboration, and staying grounded with our shared purpose for women, and also supporting our physicians providing that work. I think of a couple of things that stand out in my career with leadership. We were having a lot of issues with our breastfeeding initiation as well as continuation rates. And this kind of was my first experience where I got curious and I got collaborative. And we were really having a hard time moving the needle when it came to our breastfeeding numbers. And so we ultimately landed on the best avenue for us to make a change in the culture was to try to achieve our baby friendly designation. And it was a long journey. It was a journey that everybody from the antepartum care of the patients, interpartum care, postpartum care, as well as those in the hospital had to be on this journey. And I really learned a lot from that. The next was providing care for women with substance. We did not gain a lot of education on this when I was in training. I graduated back in 2000, and I wanted to provide my physicians with some additional support so that they could provide great care to the patients. And I partnered with one of our addiction medicine specialists to create a toolkit. Well, in doing so, we realized that there was a lot more than just creating a toolkit. We needed to amp up the clinic care that we provided for our patients with substance use. And so I actually then worked in that clinic for a half a day for a number of years until we were able to get an addiction medicine fellowship. And now we have enough physicians to really provide seamless care for our patients. And that has truly been rewarding, seeing the fruits of your labor, of my labor, and I should say everybody's labor in that regard. And then more recently, we are working on maternal mental health concerns and trying to partner with behavioral medicine to the point that we now have some behavioral medicine specialists actually embedded within our practices to provide better support. So I think what I'm looking forward to with my leadership experience and my role as ACOOG president is the collaboration and working with ACOOG and its members to provide the best care that I can over the next year for our patients, our community, and our members.
Thanks so much for that thoughtful answer. And I think that I would agree with you that one of my favorite memories and experiences is working with residents closely and seeing them grow and become leaders, and that change from that first year to the last year. And I think that's great that you've been doing that your whole career. Can you tell us a little bit about how you got involved into with ACOOG?
So, how I got involved with ACOOG, I realized early on that I wanted to get involved with ACOOG. It was actually when I became a fellow, and oddly enough, my conference was in Orlando, Florida. And as I mentioned, Dr. James Perez was not only my professional mentor, but he was my mentor within ACOOG leadership. And so he introduced me to Dr. Patty Arnett, who was the chair of the Membership and Promotions Committee, as well as I believe perhaps the incoming ACOOG president or somewhere, close, within the presidential leadership. And we had talked a little bit about my desire to become involved in committee work with ACOOG. And I can actually remember when I was up on stage getting my hood and shaking her hand, she said to me, "You want to be on the Membership and Promotions Committee?" And I said, "Yes." And then the next thing I knew, I was actually getting an email asking me to be on the Membership Promotions Committee. And that committee really introduced me to people that have been on my leadership journey this entire time at ACOOG, Dr. Mary Donna Ravazio and Dr. Mark LeDuc. And I think what was so critical about having that be the first committee for ACOOG that I participated in is I understood the member. I understood what kept them engaged, what their needs were at every stage of their career. We worked closely with medical students, residents, and senior members, and it really kept me grounded in who we serve for ACOOG. So that was a really important introduction to ACOOG leadership. The next role was the leadership committee, and that committee was started by Dr. Kate Bernardini. And this leadership committee was to develop leaders for ACOOG to strengthen the organization. And again, I think about this when I am now the incoming president. And the last couple of weeks, I've actually been calling new committee members and welcoming them to join the committees for ACOOG. And I remember getting that call myself in terms of, each of the committees that I've been on. And I have spent so much time talking to them and am so inspired by their stories. And the leadership of ACOOG is so strong with our junior members. They are so engaged and have so many ideas that they want to share as far as the development of ACOOG. So I'm looking forward to that. Dr. Patel, do you remember who called you for your first committee?
Oh, wow, putting me on the spot. My first committee was CME committee. I don't remember who called me, but I had lovely memories of my time serving there. That was one of the best committees that I was part of, but I don't remember who gave me the call.
That's okay. Well, you've been a great member of the CMEC committee, and more recently, you've got a couple of calls. The Strategic Planning Committee, which I have been lucky enough to be on that committee, and that committee, as you know, having served on that here this year, is where ACOOG looks beyond the present, and we anticipate the change ahead, and we try to align with the evolving landscapes in healthcare. And it's not all that easy. And as you saw, from our meeting this past year, we have a lot of initiatives that we want to work on moving forward. And then I got the call in 2018 to actually join the Board of Trustees. And that has been a tremendous part of my leadership development. And while on the Board of Trustees, I have also served on the Finance Investment Committee as well as the Position Response Committee. But I think more importantly is the relationships that I've actually developed with the ACOOG staff. And I can't say enough about the collaboration with the ACOOG staff, especially in the last couple of months as I prepare to become president of ACOOG. Andy Krim, our director of medical education, he has been truly inventive in terms of what we have as far as CME. Here recently, we have the micro QI. That is a collaboration between AOBOG and ACOOG to try to help our physicians and members with their maintenance of certification through OCC. We have Jimmy Evans, who I worked really closely with as the director of finance when I was on the investment and the finance committee. Catherine Ware, who's our Ember manager, who works closely with our members and has been a tremendous asset with engagement of our student and resident members. And then Martha Prudhomme, who's kind of a jack of all trades, really. I mean, you meet her, you love her. She's our program services director. One day I was sitting with her at dinner and she was making sure that one of our committee members was getting an Uber from the airport to the hotel. And she actually had met somebody in the hotel that was helping out make sure that she safely made it to the hotel. So Martha is just that kind of engaging person. And then lastly, Dr. Juria, who is our executive vice president and CEO. And I have really enjoyed his guidance as we worked through the committee assignments and other finer points of the past couple of months.
Thanks so much. That was a great answer. And I agree that the ACOOG staff really do so much and really help us look good in what we do. I wanted to ask you a little bit about your presidential address, and you've told me a couple things privately, but I don't want you to give all your secrets away, but just tell us maybe a few of your themes or focus points for the coming year that you want to try to capitalize on.
The presidential address is probably something that I have been thinking about since I got that call to become ACOOG president from Kate Bernardini. And you look at the most recent presidential addresses from Dr. Bradford, CARES, from Dr. Hood, the 4Cs. And I was really trying to decide what I was going to come up with as my presidential platform. And I kind of went and took a look at where does my leadership approach come from? And I found that my leadership is deeply rooted in service. And it dates back to my time spent at Boston College as an undergraduate. And while there, I had Father Michael Himes, who offered a simple but enduring truth: discover what you love, discover what you're good at, and discover how to use that to change the world. So, this is ultimately what led me to medicine. And I think this also aligns with A.T. Still's views that is grounded in treating the whole person, body, mind, and spirit, and honoring the inherent dignity of every human being. So, what I often say is my Jesuit education taught me why to serve, osteopathic medicine taught me how to serve, and my faith reminds me who I serve. So, my platform for my presidency is service as our North Star. So, service is one principle that has guided my career, has shaped my leadership, and grounded me in moments of uncertainty. And we are going to look at service to our members, service to our patients, and service to our communities. So, service to our members, our first responsibility is to one another. From our students finding their footing, to early career physicians seeking mentorship, seasoned clinicians navigating leadership and legacy, what ACOOG is here for is a professional home that supports and sustains its members. And then we take a look at service to our patients. The patient is the heart of everything we do. To serve patients is more than clinical excellence. It is presence at the bedside. Sometimes it is holding a hand before surgery. Other times it is sitting just to listen a little bit longer in the office. We are committed to delivering care with compassion and dignity. Our patients may not remember every detail, but they will remember how we made them feel heard, respected, and safe. And then service to our communities. Service to our communities is a responsibility and a privilege. It calls us to advance health equity by recognizing disparities in access and outcomes and taking an intentional action to address and close these gaps. Through philanthropy and outreach, we want at every conference to be committed to giving back. So we want to identify a local need and engage meaningful service together to strengthen not only communities we serve, but the relationships within our organization. Because service fosters connection, and connection lies at the heart of osteopathic medicine. And lastly, I want to introduce the ACOOG Osteopathic Moment. And this is where we celebrate our members, where presence meets purpose. With service as our North Star, the moments that define us are often the quiet ones that are overlooked. ACOOG Osteopathic Moment is an intentional space within our organization to recognize and reflect the human side of our work. At its core, it reflects who we are, our commitment not just to what we do, but how we show up. So the structure is to recognize the moment, what is the osteopathic principle, and define the meaning. This is an invitation to our members, our students, our residents, our senior members, our leaders to share their story, because reinforcing culture and identity and their connection with ACOOG. With this, we do more than tell stories. We shape culture and reinforce our values. These stories, we know, are not rare, and they're not things that show up on our metrics or reports, but they are happening every day, and we need to pause long enough to recognize them. So we are hopeful that the ACOOG Osteopathic Moment will find its way into our newsletter, perhaps even Instagram, conference openings, and other ways that we can recognize the unique work that our members do support their patients every day.
Okay, that sounds really amazing, and I can't wait to hear your speech down in Orlando and as you give us more details about your plans for the upcoming year. I wanted to segue into a couple other areas. Recently, ACOOG has partnered with Banter Marketing, and can you tell us a little bit more about this relationship and how it's evolved?
Thank you for asking about our relationship with Banter. As you have probably recognized, we have a brand new logo, especially if you're logging into this podcast, you can see that for sure. And what has been great about our partnership with Banter is they are really reaching out to our members to engage them. They are conducting surveys with students, residents, and senior members to understand what you value most about ACOOG. And the reason why this matters is ACOOG is a member-driven organization. We are about 4,000 members strong. 2,000 of our members are students, 500 are residents, and 1,300 members are senior members. So we have diversity across the entire continuum, and that is one of our greatest strengths. but we are here to make sure that we serve all of the needs of our members. So with our engagement with Banter, we are hoping to be able to recognize those needs, whether it's needs on the website, on the conference, anything that we feel can better support our members so that we can serve them and understand how to partner with them.
Another area that's near and dear to me is board certification. And I just wanted to know your thoughts about how we can encourage specialty certification through our AOBOG.
Yes, I agree as well. A big part of my development was with AOBOG. A lot of my early days with ACOOG was working with AOBOG in terms of oral board exams, as well as creating the longitudinal assessment. And I really wanted to call out the article that was in the DO from one of our board members, Dr. Deb Hergelroth, and the article is Mentoring the Future, Guiding OBGYN Residents Towards Osteopathic Board Certification. And in this, she has a call to action. And her call to action is to reach out to one student, one resident, or one program director and educate that person about osteopathic board certification. And I think this article comes at such a great time because it also highlights Dr. Hood's presidential initiative towards educating them on osteopathic board certification. So he had a task force that was under Dr. Kurt Ludwig to educate program directors about both pathways of board certification and to understand that osteopathic board certification offers a flexible and physician-centered pathway as well. And I'm looking forward to Dr. Ludwig's presentation about the success of this task force over the past year. So I think it was a timely article. And if you haven't read it, I encourage you to go to the DO and read the article.
Great. Thanks so much. I wanted to ask you, where do you think obstetrics and gynecology as a specialty is headed? I think compared to 10 years ago, we're definitely seeing more specialization, residents going straight into hospital medicine. And I just wanted your thoughts on kind of where you think things are headed and what organizations can do to lean into that.
So I think first off, I'll start with kind of answering why I became an OBGYN. And then I think it can then, answer that question. So I became an OBGYN because it is a field where you can be a surgeon, an obstetrician, a primary care, an advocate, and a leader. This is a specialty where we build lifelong relationships with our patients while stepping into high stakes, fast paced situations where our decisions matter immediately. One minute you're delivering a baby, and the next minute you're managing a postpartum hemorrhage. And I think this specialty ultimately shaped the person that I became. This is a specialty where humanity meets science in the most profound moments in birth, loss, healing, and transformation. There are hard moments. I think about some of the moments that recently encountered with my patients over the past week. Unexplained infertility, where the patients have done everything right, yet they're still not able to conceive. Pregnancy loss at any time is a situation where you grieve along with the patients. And then the diagnosis of cancer, where you are on that journey along with the patient. But then you have the transformational experiences. I recently had a situation where I delivered the baby of a patient that I once delivered. To be in that delivery room with the mom and the daughter was really exciting. And I came home and shared it with my husband, who quickly reminded me that, yes, this means you're old. So we are not just treating a condition. I think when we look at this, we are a part of someone's life story. I often tell the residents that there are 4 days in my life that I remember from start to finish: my wedding day, the birth of my 3 children, and we become part of our patients' most meaningful memories. And this is an honor and a privilege that I don't take lightly. And I say this because I don't know that the general OBGYN is something that maybe we'll see 20 years from now. And I had an interesting conversation with Dr. Hupka when we were at our mid-year conference and one of the leaders of the OB hospitalist group. And we had this discussion discussion because we were wondering, what is right for the patient? What is right for the physician? What is right for quality of care? I'm now just starting to see some laborists that are coming into our hospitals in Columbus. I have not worked, much with them directly. My hospital, they provide a little bit of support for nighttime coverage, but there are some benefits in terms of laborist roles that they play. There's also an expansion of our subspecialties. Back when I was a resident, we had maternal fetal medicine, we had GYN oncology and urogynecology. Now we have minimally invasive surgery, we have pediatric adolescent gynecology, we have global health. So there are a lot more areas to subspecialize. And I know there are discussions about having tracks of care and that there are going to be physicians maybe for ambulatory care, physicians that focus on, again, obstetrics, physicians that focus on surgery. And I think, what we have to decide is what does the training look like and what is the best care for patients. And I know, for me, I've enjoyed being a general OBGYN. Yes, there are some days like today that I question my life choices when I'm post-call and have a full day of clinic, but I still believe in the value in the work that I do. But I think medicine is evolving, healthcare is evolving, and we have to make sure, that we keep the patient first and keep in mind what is the right thing to do as these things evolve and the profession of OBGYN.
Okay, thanks so much for your thoughts on that. Last couple questions. I wanted to just ask, and this just kind of came into my head, but becoming president, doing all the things you've done, they often say it takes a village. And I just wanted to give you this chance just to thank or appreciate any of the people that have helped you along on your journey.
Yes. So I wouldn't be here without my husband and 3 kids. And I often say that the profession of OBGYN is not my personal profession, that it is my family profession. And there are unpredictable moments of being the child of an OBGYN. One time when I was on call and at my son's baseball game, my husband was actually away at a tennis tournament with my daughter. So I was there while I'm on call. I usually don't like to do that. But in the middle of his at bat, I was paged away for an emergent delivery and had to rush from the stands. And as I was making my way to the car, I saw the look of horror on his face. I paged my father, so everything was fine. He came up and picked my son. But needless to say, my son only played 1 season of baseball. And I'm not sure if it was his fear of abandonment or the fact that he just didn't like baseball. There are also the experiences that I had with my older daughter, where moments of gratitude. One Christmas Eve, we were rushing around picking out food at a fish market for our traditional Italian Feast of the 7 Fishes. And when I went to pay, the total was a lot lower than I expected. And the cashier informed me that the owner had given me a discount because I had delivered all 4 of his children. This truly caught me off guard. But of course, my daughter was quick to point out that I didn't play it very cool. And then there was a moment that reminded me how deeply our work is valued by our community. During COVID, when my youngest daughter's dance recital was held outdoors, I finished a delivery and was rushing to get there in time, but had just missed her performance. When I arrived, the director saw that I was disappointed that I wasn't there in time, but she announced to the audience that they would perform the dance once again because a mom was late from delivering a baby. These are moments that truly stay with you, the appreciation of your community, the support of your family. And lastly, I couldn't say enough about my husband. Being married to an OBGYN isn't easy, especially in a 2-physician household where call schedules can be unpredictable. This past year, as I've really leaned into my leadership role with ACOOG, he has had to step back professionally to take on more responsibility at home. And that support means everything. This has allowed me to show up fully and serve ACOOG and its members, and I'm grateful to that.
Well, that's great. And those are some really heartfelt stories you mentioned in there. Last question, bonus question I like to ask at the end of these talks. favorite place or travel memory that you have?
My favorite travel memory, I love traveling with my adult children. We've had a lot of adventures, but the one that carries the most significance is a 3 generations trip that we took to celebrate my oldest daughter's graduation from high school. So in our house, if you make honor roll all quarters in high school, you earn a trip to anywhere in the world. So she decided that she wanted to go to France. And so the trip included my younger sister, who is a world traveler. I would never be able to do this without her. My mom, and of course, my daughter. So we landed in Paris without much of an itinerary to start. We did the typical museums when we got to Paris, but we decided it would be fun to rent a car and drive to Nice. So while we were at the rental car place, the agreement printing out in French nonetheless, pages and pages and pages. And my sister and I just looked at ourselves laughing hysterically, like, what have we gotten ourselves into? Almost like a scene out of European Vacation. And we got our car, and then we had to contend with the roundabouts and the traffic laws in France. But that journey in the car where we spent just so much time sharing stories and being together was something that I will cherish. We had stops along the way to castles and museums. We even went to Leonardo da Vinci's museum and where he lived a portion of his life, which was really memorable. We got smart and we decided to fly back to Paris. And when we landed in Paris, to our surprise, it was the last day of the Tour de France. And my sister and I, growing up, always loved watching the Tour de France. And to actually watch the final leg of the Tour de France on the Champs-Elysees was truly a pinch me moment. But what truly is remarkable about this trip is shortly after, and we definitely saw signs of this, my mom was diagnosed with Alzheimer's dementia. And that was truly the last trip that she really took traveling far away from home. And so when I look back on it, it's the quiet moments that we shared, the stories we shared, talking in little cafes, that long car ride to Nice that I will cherish the most. And I guess not to leave this on too much of a downer, my son, after my older daughter, I have 3 children, he graduated from college. And rather than picking a trip anywhere in the world, because he did earn it, he decided he wanted to go to Taylor Swift, the Eras Tour, and invite his 2 sisters, which probably cost me the equivalent of a European trip.
That's hilarious. That's great. Thank you so much, Dr. Jennifer Papp. Jen, it's been great, and I can't wait to see you in a few weeks, and I can't wait for everyone to hear all about your presidential year. Congratulations. Thanks so much for taking some time out of your schedule to speak with me today.
Thank you so much for inviting me. I think the work that you've done with this podcast is tremendous. And I just want to congratulate Ashley on a tremendous year. And I want to remind everyone to get their tickets for the presidential celebration streaming into the presidency. Dr. Patel, do you know what character you're going to go as?
I know, is it like the theme Bridgerton or some kind of?
Yeah, any streaming show. So it could be Bridgerton, Ted Lasso, Emily in Paris, The Pit, anything.
I didn't know that was the theme actually, so I was just gonna go with formal attire, but I didn't have a character, unfortunately, but I have some time to think about it. Are you gonna reveal your character or is it a surprise?
I think my family is channeling Ted Lasso, but we'll see how that goes.
Ah,
And
cute.
if you're caught off guard, we will have different accessories so that you can feel like you're a part of the theme for the presidential celebration.
Oh, well, that's great. Thanks. I can't wait to be there and party and celebrate with you.
Thank you so much. I really appreciate this opportunity, and I look forward to seeing everyone in Orlando.